Hi, in this video, I will be talking about mucositis. What is it? What causes it? And how can you manage or even prevent mucositis? I just want to let you know we're going to be going live with a live stream and Q&A on May 21st, talking about ways to help you cope with breast cancer. So you can click on the free invitation below. Whenever we use a term that ends in itis, we're talking about inflammation. So mucositis is inflammation of the mucous membranes. We have mucous membranes all over our bodies, from our mouth all the way to the end of our GI tract. And when people get mucositis, it can affect any parts of the body. The parts of the body that people tend to notice the most are when they get mouth sores. So mucous membranes of the mouth or the oropharynx, what we swallow. That's a highly sensitive area. About 1 in 20 people getting chemotherapy will get mouth sores. So chemotherapy, which affects rapidly dividing cells, can cause inflammation of the mucous membranes, most commonly seen as mouth sores. Radiation therapy can also cause mucositis, but remember, radiation only goes to where we direct it. Unlike chemotherapy, which goes through your whole system, radiation therapy is sort of directed to one part of your body. So if a part of your body that has mucous membranes is in the radiation field, you can also get mucositis. Examples would include somebody whose radiation goes to the middle part of their chest and the esophagus, which is in the general area, or the tube that connects from our mouth to our stomach. If that's in the radiation field, you can have esophagitis, or inflammation of the esophagus, and the bigger category for that is mucositis. If somebody's getting radiation therapy to the spinal column, to the bones of the spine, in the area of the mouth or the pharynx, they can also have mucositis from radiation therapy. How do you know if you have it? Well, most inflammation in the body causes pain. So mucositis is associated with painful swallowing. We also see people having a dry mouth or thick saliva. If you have mucositis lower down in the intestinal tract, you can see diarrhea. So diarrhea if you're getting mucositis in the colon, or if you're having radiation to the low spine, and that includes the lower intestinal tract. What do you do if you have it? Well, you want to be really careful not to provoke the mucositis. You don't want to pick or poke at the areas in your body that hurt. Although it might be tempting to see what's causing the appearance of or pain in your mouth, you want to be really gentle. So we recommend that you actually increase your brushing. So if you tend to brush once or twice a day, you might want to brush 3 or 4 times a day with a very gentle toothbrush. Why would you do that? Well, mucositis, if we have bacteria in our mouth, and the bacteria can delay healing of any areas of mucositis, and by decreasing the bacterial load in your mouth through more frequent brushing and flossing, you can actually help mucositis areas heal more quickly. I don't generally recommend using hydrogen peroxide. Hydrogen peroxide works by breaking open the membranes of bacteria, and yes, we want to decrease the bacterial load, but hydrogen peroxide can also disrupt the membranes and the cells that are trying to regrow in your mouth. So I don't recommend that you use alcohol or hydrogen peroxide if you're experiencing mucositis. It can be very helpful to have cold drinks, not super cold, but cool or cold drinks can help with the discomfort of mucositis. You can also talk to your medical team. There's a mouthwash we can give you that has lidocaine, a numbing medicine, an antacid like the brand name Mylanta, and sometimes even Benadryl, given as a mouthwash, all mixed together, can help soothe any inflammation in the mouth. So you can talk to your medical team about getting a mouthwash that includes Benadryl, lidocaine, a topical anesthetic, and Mylanta. That has to be mixed up in a pharmacy for you. You can't just get this off the shelf in a pharmacy. They have to compound it for you. And finally, I wanted to talk about some ways that might decrease the risk of getting mucositis in the first place or getting it again if you have experienced it. You can use ice chips in your mouth, very cold drink. It would have to be ice cold, and you hold this in your mouth for as long as you can when you're getting an infusion of chemotherapy. Now, mucositis, we see this only in about 1 in 20 people, so it's not so common that I recommend this for everybody. But if you get this with chemotherapy, trying this with the next cycle can really help. Nursing literature has published clinical trials where cryotherapy or cold therapy is used to decrease the concentration of chemotherapy in the mucous membranes of your mouth, and that can decrease the likelihood of getting mucositis again. I hope this has been helpful. If it has, click like and subscribe, and drop a comment below if you have some tips or tricks on how to decrease the likelihood or severity of getting mouth sores.